So first of all, thank you all very much for joining us on this really important item. So my name's Dr. Anne Hoskins. I'm chair of the Yemen SIG of the Faculty of Public Health in the United Kingdom. And I'll be setting the scene for this important webinar. So we have a panel of distinguished speakers and high-level officials from Yemen and the UK, and they'll be discussing the recent spread of COVID-19 pandemic in Yemen and the possibilities and capabilities of the Yemeni health sector and WHO to fight, contain, respond to confront the pandemic. It's also, for me, based in the UK, how we can support our colleagues in Yemen at this difficult time. So the objectives of today are to raise awareness of the COVID second wave in Yemen, identify issues and needs facing the Yemeni health system to fight against COVID, practical solutions to fight the second wave and to minimise the impact. I'm going to pass straight over to my colleague, Dr. Mutahar, who is co-lead of the Health Professionals Yemen, a newly formed charity who we're collaborating with on this webinar. And he will oversee session number 1, which is a senior high-level discussion. Moving on then, after that session, there'll be a Q&A. Please put your questions in the Q&A box and Dhikra will pick them up and she will lead the senior level discussion. Session 2, technical and research, Arzak Ahmed will co-lead that. And again, please put your Q&A and technical research session questions in the Q&A box, and then closing remarks by Tahar Ali Qasim, chair of the charity. Finally, just to let everybody know, this webinar is being recorded, and so there will be opportunities for people to look at it on YouTube at a later date. Thank you. I'll hand over now to Dr. Mahdi Mutahar.
Thank you very much, Anne, and a very warm welcome again to all our speakers. As Anne indicated, we have this webinar divided into 2 sections, senior level discussion where our distinguished panel is going to shed lights on the current COVID-19 health situation in Yemen, and also to attract international awareness and attention to this crisis. In the second section, we will have a discussion around technical and research papers that would hopefully provide us with an insight into the possible ways and methods in tackling this crisis. We are starting this webinar with Dr. Adham Abdul-Mun'im. He's the World Health Organization representative to Yemen. Dr. Adham is going to tell us about the second wave COVID-19 in Yemen and how does the World Health Organization support the Ministry of Health in Yemen. Over to you, Dr. Adham.
Thank you, Dr. Mahdi, and I want to thank the organizers for giving me the chance to highlight what's happening in Yemen in terms of COVID. And this is, I think, is very important for integrity of the work that we're doing and for disseminating right information about what's happening on the ground. So let me, if you allow me to share my screen, I have prepared a few slides. Let me start by shedding some lights on on what's happening on the ground. Yemen has reported only around 60 cases with some 1,000 a little over 1,000 fatalities. These numbers are not adequate at all. They actually represent 1 over 50 or 1 over 100 because these are the total cumulative numbers since the start of the pandemic. The case fatality rate, according to those numbers, is 19%. And if you look, even with those little numbers, if you look at the pattern of registration of the cases, you would definitely see that there has been a first wave, which has concluded probably last August, and then the start of a second wave that is currently ongoing in all governorates. So most of the governorates that are reporting, if you look at the names, never mind the bars, but the names are mostly coming from the south. The southern parts of the country, which holds 30% of the population, that are reporting as much as they can. The surveillance system is not that strong, but at least they are reporting. 70% of the country in the north are not reporting as such according to one reason or another. We tried as WHO to get those figures, but it's very hard to do that. But how do we know that that we do have that these numbers are 150 or 100? In last December, WHO conducted a seroprevalence survey by collecting blood samples of almost 2,000 people from Aden, in which almost 1 million population is there, very randomly selected from different suburbs and parts of the city. And in Aden only, where a 1 million population, it was discovered that 27% already have antibodies against COVID, meaning over 500 of the 2,000 had it. If we extrapolate, this means that almost 250,000 have been infected from the first wave. This study was conducted after the first wave was concluded, while we're only reporting 5,000. You can do the math and see how much it is. And of course, without proper data, how can we plan? But is that under reporting because of lack of labs? As you can see, the country has 10 functional labs that can test COVID-19. 3 are not yet functional, but we're working on their functionality. You know, that sometimes they're missing kits, they're missing PCRs, and so on. But at least 10, and as you can see, they are almost distributed mostly on the north. There are also additional 8 private labs that help also in identification. In the death rate, I said that the case fatality rate is almost 20%, and out of 5,000 reported, almost 1,000 died. Is that because of lack of intensive care units? The answer is no. We do have 24 dedicated intensive care units in the south and a similar number in the north, a total of 48 in the country. And they are distributed between Aden and Sana'a and other governorates, as you can see. Some are still closed since last August, but they are reopening now, especially in the north. And there has been a request to WHO to support new ones with the PPEs, medical equipment, and consumables. So where are we going to, how can we as WHO support? There's a big funding problem in terms of and gaps. And as you can see, we have requested almost 142 million to be able to respond to the catastrophic situation on the ground right now. We had some, almost 23.5 million that is already in balance with us. 37.3 have been consumed since the start, but we've asked for additional $84 million, of which we only received 13%. And out of the 13%, we still need 6 million urgent right now to respond to the lack of beds, lack of oxygen, and many other issues that we see on the ground. And that's the balance of what we have right now, the 23 million. And as you can see, the purpose of this slide is to show you the generous donors that are contributing to the COVID-19 in Yemen: Islamic Development Bank, Korean government, the King Salman Relief Fund, Tetra Pak, UN organization, OCHA, and then the World Bank. These are the ones that we have right now, and those are the current balances. Still, we need more. We need to mobilize more donors for the cause. So where are we going to use those urgent needs? As you know, WHO has divided the response of COVID into 10 different pillars, going from country coordination to risk communication, to surveillance, to points of entry, to labs, infection prevention control, case management, operation support, and then maintaining essential health services while the pandemic is ongoing, plus vaccination. And these are the figures that are estimated by WHO. We're still struggling to find donors. I said that there is $6 million needed right now to respond, to be able to respond to the cases on the ground. At least $3 million of them is needed in the coming 1 or 2 months. The next one, almost $2 million are needed in June, July, and the remaining almost $1 million is needed before August or September, according to our estimation. And those are the short-term needs that those at least $6 million will satisfy according to each pillar. I won't dwell on the slide because of the time, but as you can see, WHO has a plan for each pillar. How much is it needed? How much is costed? And in terms of coordination, risk communication, surveillance, points of entry, and labs. These are the ones identified as a shortcoming in the next short time. I won't dwell on that slides, but definitely would love to share them with all of you to show you that there is a plan from WHO side according to what donors is coming, and that plan covers the 10 pillars, especially the COVAX vaccine, pillar 10, in which we have 360,000 doses received. I'm glad to say that only 2 days ago, the campaign started in Aden. Vaccination is ongoing, but we are lacking operational costs. Still haven't received any operational costs for that vaccine. We are waiting for 2 million doses to be supplied, which covers 23% of the population in 2021, and we don't have the whole operational cost for them. The plan is adequate that has been developed for COVAX. Whole of Yemen, it covers, prioritized according to WHO framework, and phase 1 that is ongoing right now covers the healthcare workers, people with comorbidities and vulnerable populations. But there are still challenges that, as you can see, we're not sure of what's coming next, monitoring and evaluation, the lack of security, the distance, the coverage, the vaccine hesitancy because of rumors, and the uncertainty to cover the beyond 20% is bothering us. This is my last slide for you as food for thought to see how can we stop the surge of confirmed cases. The cost of transportation is killing WHO. It has increased twofold because of the problems and the logistics and the ongoing conflict on the ground. We are finding difficulty to find charter planes or procure from outside. Operational cost for COVAX, as His Excellency alluded to at the start of his presentation when he was cut, fuel, oxygen, incentives, water is a big problem. These are not normal WHO activities in countries. We are supplying this only in Yemen, trying to provide this to maintain the operation of health facilities. There are other pillars that are neglected completely: risk communication, community engagement, infection prevention control, points of entry are totally neglected and not supported by many donors. There is a gap of 83% funding gap that we need to look at. The resumption of essential health services is on top priority, not fully funded, and the surveillance and data is generally all over the country very weak. Thank you so much.
Thank you very much, Dr. Adham, for this useful insight. We will try to get back to His Excellency, Dr. Qasim. Dr. Qasim will tell us about the needs and challenges in Yemen to fight COVID-19. Over to you, Dr. Qasim.
Yes, okay. Thank you, Dr. Mahdi. And this interruption is one of our suffering in Yemen, as now electricity is shut down. Okay. I have some, I didn't listen to what Dr. Adam said, all of it, but I have some comment on it. At the start, as of all of us know, what their situation is suffering from all aspects and from war last 6 to 7 years, and also because of their low economic that make our health system is weak and poor in many aspects. But when the new government start 4 months ago, we came back to Aden and start work, we from the start try to raise our awareness from the coming COVID will come to us, as it was all the world, it was spread, but in Yemen it was come late in the mid-February, maybe because of we have limited flight with the outside. So the Ministry of Public Health start from the January, we start activities to be ready as we can. We have with our all limited resources, so we start training of our health staff for how to be ready for the COVID, and we start providing them with all PPE and equipment to the isolation center that Dr. Adham mentioned. We have it is under the logistic governorate in Aden, in southern and eastern governorate. We have almost about 16 isolation center, and this we will start to provide them with equipment with the help of our partner as WHO and other. But all these resources and all this center was with the limited resources, and it cannot comply with the epidemic, as this second wave, it is rapid and quick spread more than the previous one, as the cases come to duplicate in 1 month as in 3 months in the first wave. And so this make more pressure in our health system. And as Dr. Adam, our surveillance in the southern and eastern is better than nothing, as he noticed in the northern governorate. As we all number, he depend on is come from our surveillance system in the southern and eastern governorate. So it is, yes, we know it is only limited, it is not the real number of the cases, but at least it detects the cases who come and to the lab and to the hospital and they make tests. And we know it is, yes, it is not the real number and it is only limited number, but it, at least it gives us some measure, all of us depend on it. So in the Gulf, in the, with the Ministry of Public Health in Aden, with all governorates, we have now PCR unit in all governorates, so they can make a screening of the cases. We have 13 PCR in all governorates in the south and east area. So we have now, we know it is, as Dr. Adam mentioned, this center, but unfortunately, this isolation center, as he mentioned, is only, it can only 600 beds and about 160 ICU bed. And how you can imagine only with 8 EBG machine and with limited ventilator, with limited oxygen cylinder, as all of our center not respond to what these isolation center need, and also most of the equipment that needed. So what we do with our partner is still limited and not the real response to what we are facing in Yemen now, because we have many challenges there, as they have because of the political and conflict, and we have now dividing of the authority, as you know, Sana'a, and it is not 70% population there, Dr. Adam. And the southern is more than 30, because you know we have more than 3 million displaced from the northern to the south and to the east area. So we have, because of this duplication of the authority, we have now an open and transparent authority in Aden. Every number we announce about it, while in Sana'a is closed, and we didn't know what are the real number, what are the even, they refused to accept the vaccine campaign. So these, some of our challenges, because of these divided authorities, make difficulty how to contain this epidemic. Also, we have problem because of the war and low socioeconomic. Many of the population refuse the closure and take of the precaution, and even the local authority refused to do closure of the many public places on the market, unless while we requested to take this aggressive management to contain this epidemic. We have also this community ignorance for the precaution and preventive method, and this makes a lot of pressure on the health system. We try to increase the health education and awareness, but the problem of the low socioeconomic make these many people refuse many of the closure method, while we are in the government shut down in the school and the university and many aspects that we can control, but for the market and the mosque, we have difficulties in closure of these crowded area. And this make more pressure of on the health system because of the spread of the virus. We have challenges of the shortage of the qualified trained ICU staff, because all of us know, because of the war and the problem, many of our qualified trained Yemeni doctors travel to abroad, outside, many of them. So we have aggressive shortage of the ICU staff, especially the ICU anesthetic ICU staff. And also many of them work in private because of the good salary than in public. We have shortage in ICU equipment, as we have shortage in the oxygen exchange, like oxygen cylinder, supply, ventilator, monitor, defibrillator, EPG. As I mentioned, we have only 8 all in our isolation center. And also we have problem of the and a special problem in ID camps and also refugees. We have about 2 million of ID camps in, like for example, in Marib, and now they are suffering from Houthi aggressive on them. And this community was closed and crowded, and they are limited health facility there, and they make more pressure on the health system and the spread of the virus there. Also, while Yemen in the war is still receiving many African refugees from the Somal, from Ethiopia, still a lot of them come to Yemen, and also these people have weak immunity, and also they need a lot of support to their camps. So what we are looking for from our partner, they are, as Dr. Adam mentioned, a lot of, we have a lot of fund in the, but the problem we are facing with them, the timing of receiving this fund, because the interference with this epidemic, the timing is play an important role, because we are now in the top of this crisis, so we need interference now, because later on it will, every minute, every day we are suffering, and we are receiving many of our patients dying, and as he say, a lot of the mortality rate in ICU is high because of the two problem, because of the many of the patients not come to the hospital and to the center. Only they came at the end, or when they are in moderate or severe cases, but mild cases, they are refusing to go to the hospital and manage at home and come to the center while they are in the severe cases. And also of the shortage of the trained ICU staff and the look of the equipment. So we are demanding for the help of our all partner and other all the world, and the timing of the help in this aspect is critical for us. And thank you.
Thank you very much, Dr. Qasim, for this useful insight. Our next speaker will be Professor Maha Rabat, who is the World Health Organization Special Envoy on COVID-19. Maha will share with us her comments on what have been said by Dr. Qasim and Dr. Adham, and also will give us an overview of the COVID-19 response in EMR. Over to you, Maha.
Well, thank you very much, Dr. Mahdi, Your Excellency, Dr. Qasim, Dr. Adham, colleagues. Thank you very much for the invitation to participate in this important meeting. And from the presentations given by His Excellency and Dr. Adham, now we see that there is a situation in Yemen. And the situation in Yemen is reflecting the situation, the epidemiological situation, which is really occurring worldwide and in the region itself. So we have an accelerated epidemiology pattern. We have this, yes. And the issue here is that, so now for the region, you would know that the region with its 22 countries, there is conformity and disconformity. So there are discrepancies between countries and inside the countries itself, but there is not a uniform pattern for the countries in the region, where we have the very high socioeconomic standard countries in fragile contexts, humanitarian and emergency, and the lower and middle income countries. So whatever brings them all together, and this is an opportunity, is the COVID situation. What is really happening, and how has the COVID really steered and urged the rapid response, emergency response, not only for the COVID, but as well for the whole government strengthening of systems that are there, because we need to see and the COVID not only as a health and prepared an emergency problem, but as well in the context of the disruptions that it imposes on the social aspect, the health aspect, and as well the economic aspect. But when we're talking now, and as I would like to start a little bit earlier with the first case that happened that was reported in Yemen, and this was on the 10th of April 2020, which means like it's almost like a year now with the reporting of the first case. So during 1 year, there are aspects that have been known, there is experience learned, there is issues that we can build upon. It is a learning experience. We know that every country reaches a certain point by what has happened during the past, what we have learned during the past, but we need to step back and to see why are we in this situation now. And definitely in Yemen's situation, the humanitarian and the emergency issue is like, you know, it's the umbrella of everything that is really happening on the ground, because the COVID is not only the issue that the country is facing and has to respond to, but there are other public health issues and the war issues, the instability issues, the food security issues, the malnutrition issues, the diseases issues, the cholera issues, and as well the system itself is fragile. So we're having overburden of other challenges that has to be seen within the context of what needs to be undertaken in order to support this second surge or a third surge of the outbreak or of the pandemic. So within this, the humanitarian crisis, as well as mentioned by His Excellency, we have the displacement, internal displacement, and the internal movement of the people, which is continuous. You know, it's not like you have people that have moved and then it is settled protractedly. No, this is a continuous issue. So all of those challenges are really barriers to a proper and a strong response. But as I see, what do we need and how do we see the priorities of what needs to be done? Because we know that we need to see what has happened with the health systems, with the health workforce, as mentioned by His Excellency, with the communities themselves. Because whenever we're talking about the disruptions and the challenges, definitely the health system has a higher impact on the response. But before the health systems, we need to have a proper public health measures in place. And these are very important, and as important as the clinical management part, the surveillance part, public health measures part, and the community engagement and the community role. I want, and I might be wrong, you might correct me in this, the closure of and stopping all of the activities, this is only done for a particular or a certain period of time in order to give a chance to the systems to function. But this is not a longer term response or intervention. But there are things that needs to be emphasized. It's the risk communication, it's the community public health, the role, each and everybody's role. How do we make them function, and how do we empower the communities to work for their own benefit and for the communities and the country's benefit, which is as important. And it's not because I'm a public health professional, but these are issues of the package that we need to repackage now in the humanitarian context and emergency context of Yemen in order to enlarge and strengthen what do we have in hand. Of course, parallelly with supporting the management, the clinical part, the health system part, the health workforce part, because we need to rethink of innovative ways of okay, of compensating for the lack of the health workforce, but at the same time to build on the solidarity, to build on the international interest in supporting Yemen as well. And this requires the solidarity on the global level. So building on our learnings, what is it we need to prioritize? So we know that there is accelerated epidemiological pattern, and we know that now we have tools, but the tools are equitably distributed. So we're talking now the testing, we're talking now the vaccines, but at the same time we're talking the community's reaction and response to all of those issues. You know, the delayed response of the people seeking out for health services, the delayed response for the vaccination, but as well, where are the public health measures of surveillance, of screening, of isolation? These are issues that we need to push forward, even if they are difficult to emphasize or to build on at the same time. I want, because of Dr. Adham's mentioning of the international support and international organization support, and we know that in humanitarian settings, there might be some fragmentation in the response, and this is always expected. But I would like to say we need to do like cross-organization review, you know, for the tools, for the processes, in order to enlarge on what we really have in hand, to have a comprehensive framework that is meaningful to the situation. Now we're talking the North, now we're talking the South, but we have people involved in the North and in the South, and we want to reach out to them, and we want to empower them to take the role in all the measures that are really taking. So despite the challenges that we need now to step back, and you have very clearly outlined, we need to one by one see how can we overcome those challenges. Maybe we need to go to innovative ways of thinking. Maybe we need to reposition our vision itself. We need to involve the people themselves. This is not the only government's response. This is a whole society, whole of government. And when I'm saying it, it's not like a slogan. No, we need to put it in the leadership and in the governance part, which might be fragmented and dissociated. But we need to rebuild it and see how we can manage it in terms of the health, the social, the economic issues that we need to support, and as well to be more equitable. And in this position with other countries and with Yemen itself, we need to see what are the other public health issues and problems, and to bring them all together into a framework of action, including the preparedness and the response for the COVID, for the food security, for the diseases, for the water, for the climate change expected in May. So we need to look and anticipate as well what could happen. And then we have to be more prepared, even to the limit where our system and our resources can support this. I mean, together with the solidarity part and the support of organizations working on the ground. And I'll stop here and to see if there are questions and answers. Thank you very much.
Thank you very much, Professor Maha Al-Rabat, the World Health Organization Special Envoy on COVID-19. As part of this senior level discussion, we are very fortunate today to have the Faculty of Public Health in the UK with us, which we consider a window of hope that can be opened with regard to the situation in Yemen. We have Professor Neil Squires, the International Registrar for the Faculty of Public Health, who is going to talk about the public health, the Faculty of Public Health commitment to global solidarity with the current crisis in Yemen. Over to you, Professor Neil.
Well, thank you very much indeed. And I hearing those stories of the situation in Yemen and the huge challenges that there are, but also the sterling work that Dr. Adam has highlighted that WHO are doing. And His Excellency indicated the huge efforts that the government are trying to make in order to address the situation. But Dr. Maha has highlighted that there are things that we can do, but we all feel so helpless, often a long way away, and we need to think about what we collectively can do to begin to address these issues. I'd like to sort of speak about how we perceive Yemen from the UK, because this increases our understanding of how the UK can engage. And in trying to find out more about this, there is a Foreign and Commonwealth and Development Office situation report that's updated every couple of weeks. And it is clear that in the monitoring of the global COVID situation, there is clear recognition. And I've lifted a paragraph here from the latest, well, from the situation report from the 30th of March, which the Foreign and Commonwealth produces and circulates to a very wide audience. And it highlights that many conflict-affected settings are experiencing a very sort of severe third wave, and it mentions specifically Syria and Yemen undergoing particular challenges. There are then detailed slides which highlights that the problem is also in many neighboring countries, but there's a specific reference here. I mean, but these figures are out of date compared to the ones that Dr. Adam shared, with now over 5,000 cases being reported. But he's also highlighted the huge underreporting that exists, that this is a minor representation. But what is key and what has been highlighted in these reports is this 36% increase in the number of reported cases. So there is recognition. But I'm delivering this message at a time when we've just had our Foreign Secretary's announcement of the UK's aid programme. And although the UK aid programme is still a generous one, it's less now with the reduction in the aid budget from 0.7 to 0.5, and that will have implications. And we've already seen a campaign from non-government organisations about the reduction in humanitarian support that these cuts in the aid budget have. And I highlight this because one of our roles as citizens of a country that is committed to supporting international development is to be advocates for that financing support. And that's financing support that has Dr. Adam clearly identified, and Dr. Qasim and Professor Mutahar has all highlighted, is very much needed. And so we need to ensure that just because every country is facing a financial challenge as a result, that is not a reason to stop providing strategic support to important partners across the world. The next slide really highlights one particular, and the reason I've included this, you don't need to read all the detail, but if these slide sets are circulated afterwards, there are a number of hypertext links within these reports. But the number of the 3 million displaced people in the 200 ID camps were mentioned in the previous presentation. And this is really just to highlight that there have been 3 recently published reports from the International Federation of the Red Cross, the IOM, the International Office on Migration, and the UN High Commission on Refugees, all highlighting the particular challenges of pandemics for people who are already vulnerable because they've been displaced as a result of conflict. And these reports highlight that we need to be particularly focused on women and girls, the most vulnerable in society, displaced as a result of conflict, who will be impacted further by the risk of COVID infection. So I think important resources to think about. The next slide, really, again, you won't be able to see all the detail, but it's shared because of the hypertext links. Effectively, the slides will be made available, but they're highlighting that a number of initiatives that the UK government has been committed to. So kovacs has been mentioned, and kovacs is the mechanism for ensuring vaccines are made available, but it is clear that many countries in the world, particularly resource-poor countries, are not yet receiving anywhere near the volumes of vaccines that they need. And we've also already heard a description of the challenges, the operational costs of delivering vaccines when they do arrive. So it is not only the absence of vaccines, but also the challenge of delivery that is a particular concern. What I really wanted to focus on, though, is what role can the Faculty of Public Health, for example, play? And the Faculty of Public Health is a membership organisation of public health professionals across the UK and indeed internationally. We have over 400 international members. But also it has special interest groups. There is a Yemen Special Interest Group that connects with the broader community. And I know that there has been a strong link between the Yemen Special Interest Group and the Yemeni diaspora in the UK. And one of the things that we can do together is work on advocacy. So we can advocate against the cuts in, for example, the UK aid budget, which has led to a reduction in humanitarian support. And although the UK aid budget is still a very large budget, these reductions will have a real impact, and it's our collective voices that need to be raised to highlight things that we consider important. We also need to be promoting things like the equitable distribution of vaccines to make sure that all countries, and particularly the poorest and most vulnerable, gain access to this. Now, kovacs has been established for that, but the faculty has recently, with the Academy of Medical Royal Colleges, signed a letter which is saying that the over-ordering of vaccines that the UK has done to protect health in this country, we need to ensure that the excess of those vaccines are distributed to support the global campaign to increase vaccination. And this is in everybody's interest. The world will not be safe until every country has achieved high levels of vaccination against COVID. So it's in everybody's interest. So hopefully we're pushing against a wall, an open door, in order to encourage this. Solidarity has already been mentioned, and I think raising our voices together, publicising and recognising the challenges that Yemen is facing, demonstrating that we can work with and support our colleagues, the doctors, nurses, health workers, the people of Yemen who are struggling to deal with the pandemic. That communication and demonstrating the solidarity is important. So we should seek to find whatever means we can to further that. Capacity building. We've already heard about the challenge of health workers, some of whom have not received their salaries. Often they're working in remote situations. It's difficult to get access to learning and development in order to maintain professional standards. And again, members of the faculty have been working to try to identify ways in which we can continue to support our professional colleagues, build these peer-to-peer linkages, which I think are incredibly important. And there has been some initial work to develop a Yemen mobile health app, which would be a communication channel for increasing the flow of information and the exchange for these professional linkages. And these may seem like small things, but for individual health workers who appreciate communication, it can increase people's spirits in the absence of any further and external rewards. And people are working in very difficult circumstances. So trying to find whatever ways we can to provide as much moral support as possible and practical support as possible is important. And the other challenge really is in supporting sort of data collection. We've heard from Dr. Adem that the challenges faced in collecting accurate information, and over the longer term, developing the systems that allow not only information to be collected, but information to be communicated so that we have a clear picture of what is happening in Yemen and can communicate that to the world in order to galvanize support to bring the additional assistance that has been so clearly articulated as needed, will be critically important. So again, it seems like very little given the huge context, the huge challenges that have been set out. But I think it's only through our collective efforts and our commitments to work together as a global community and work together as health professionals supporting one another and to work together as a community of the Yemeni population in the UK, showing solidarity overseas and building some of these linkages. And the Faculty of Public Health certainly wants to play an important role in that important collaboration and cooperation. So I will leave it there. Thank you.
Dr. Dhikra will moderate the session and raise any questions to our distinguished panel. I would like also to highlight to our viewers and followers on social media that some of the key questions will be translated into Arabic as needed. Over to you, Dr. Dhikra.
Thank you, Dr. Mahdi, and thanks to all our distinguished guests. Assalamu alaikum, good afternoon, and Ramadan Kareem to all of you. I think you have learned a lot from these four presentations, great presentations actually by our distinguished and honorable guests. And to the extent that we all feel the burden that Yemen is passing through now, in addition to all the dilemmas and challenges that Yemen is passing through the last 9 years or even the start of the war. Let me acknowledge here, first of all, that I am here as Dhikra Al-Nuzaili, representing my colleagues from several health initiatives that have been formulated since the last year, since the start of this pandemic. And this is one positive thing that we need to mention. Doctors, I'm representing doctors from Yemen, representing doctors from the diaspora. I'm representing YEMFNet, representing Yemen doctors in diaspora, representing Interim, representing HPY. So this is the involvement and this is the participation of those NGOs and initiatives that are trying their best to support and to formulate solidarity towards alleviation the Yemeni health status. Okay, to cut it short, I have to go to the session of the questions and answers, but because of the request from some of our colleagues who need to have translation, a very short translation about what our speakers have said, I will very briefly translate that and go to the questions and answers. المفروض إنه أترجم عفواً المفروض إنه أترجم بالعربي. انقطاع الكهرباء، انقطاع البترول، هناك صعوبات بالنسبة لبناء قدرات الطاقم الصحي، هناك نقص حاد في اختبار كوفيد-19 على الطاقم الصحي وغير الطاقم الصحي أو على الحالات أيضا التي تشتبه في إصابتها في كوفيد-19. ذكر أنه في حوالي 13 PCR معمل PCR متوزعين على الجنوب، مناطق المحررة أو الجنوب، 600 سرير، 160 ICU سرير موجود، ونقص حاد في أجهزة التنفس الاصطناعي والأكسجين وإلى آخره. طبعا الانقسام السلطات والتوتر السياسي بيضيف إلى هذه المشاكل الكثير والكثير كما نعلم. نقطة هامة أيضا هي ضعف الوعي عند المجتمع، صعب التواصل مع السلطات المحلية أيضا في المناطق تحت سيطرة الشرعية، ضعف طواقم العناية المركزة كما ذكرت، وأهم من هذا كله أيضا هجرة الحقول الصحية أو خروجها من اليمن بسبب الوضع السياسي أو الوضع المتوتر. دكتور أدهم أشار إلى مواضيع مهمة جدا بالنسبة للفندنج أو بالنسبة للدعم اليمن محتاجة، مع حوالي 140 مليون أعتقد اللي كان مقدم لليمن أثناء الجائحة، حوالي 23 اللي استهلك أو اللي صحني بعدين الدكتور أدهم، 23 مليون اللي تم استخدامه، 37 مليون اللي محتاجينه، 6 مليون محتاجينهم فقط في الشهرين القادمة، و60 مليون urgently needed برضو في السنوات القادمة لمجابهة الجائحة. دكتورة مها ذكرت التحديات اللي بيواجهها الإقليم عموما، وهي تحديات ضخمة، وفي تفاوت في هذه التحديات، وفي تفاوت أيضا في الاستجابة للجائحة، وبذلك هذا يشكل صعوبة أيضا على المكتب الإقليمي كيف يوحد المساعدات أو كيف يوحد النهج للمساعدات للإقليم ككل. طبعا اليمن وسوريا ومناطق النزاع لها خصوصية أهم، لكن أيضا ستوضح لنا بالأسئلة والأجوبة كيف هذه الخاصية ممكن يتعاملوا معها. بروفيسور نيل ذكر أشياء مهمة، وهذا أشياء تسعد الصدر، بأنه هو أقر أنه في نقص حاد في الدعم المقدم لليمن بسبب أيضا الجائحة اللي بتواجه العالم كله، لا سيما بريطانيا، وإحنا عارفين أن بريطانيا الآن تعتبر والهند من أكثر الدول مجابهة وتعرضا لشدة موجة السكند والموجة الثانية والثالثة للفيروس. ذكر أيضا أنه كما حاولت أترجمها كلية الصحة العامة أو لجنة الصحة العامة اللي هي لجنة عليا في بريطانيا، بتتكون من 400 منظمة وعضو أعتقد داخل بريطانيا، ومن أطباء ومن يمنيين أيضا هم موجودين في بريطانيا وفي المهجر الآخر. هم يمثلوا هذه الكلية، وهذا شيء جميل جدا. لكن طبعا بسبب النقص الحاد في الدعم تشعر المنظمة أنها صعب أنها تحاول أن تقدم دعم، لكنها ستعمل جاهدة على جلب الدعم بكل ما استطاعت. تحرص أيضا على دعم اليمن، من أهم اهتماماتها دعم اليمن باللقاحات، الدعم المادي، تحاول ترجع الدعم المادي، دعم الطاقم الصحي بالتدريب، وتوحيد الصف عموما باتجاه اليمن، وتحاول بناء القدرات للطاقم الصحي وغير الطاقم الصحي في هذا المضمار. أوكي، عشان ما نطيلش عليكم، معنا حوالي المفروض إنه قريب نخلص، لكن بحاول نمدها إلى 20 دقيقة وندخل في أسئلة المشاركين، وأنا لاحظت أن في أسئلة جدا مهمة. نبدأ بالأسئلة الأولى. في كثير من الأسئلة بصراحة تحدثت على سعادة الوزير، يمكن نبدأ بحضرتك. اللقاحات المقدمة لليمن 360,000، 10,000 منها ستقدم لمناطق الشمال. ما السبب في ذلك، وما هي أهم العوائق اللي وسمع البعض أنها أيضا رفضت؟ فهل لك أن توضح لنا مثلا حيثيات الموضوع هذا إذا تكرمت؟
Doctor, could I ask you to repeat that question in English as well for our viewers?
Oh, yes, sorry. Okay. Dear Excellency Minister of Health, Yemen, there are a lot of questions. Actually, I will start by the most popular and most common one asked by many attendees, which is about the 360,000 vaccine that was provided to Yemen last month, I think. And you provided 10,000 to the northern governorates. Would you please explain to us how, and there is a rumor actually saying that this 10,000 was rejected by the northern areas. Would you please explain to us about this status? Thank you very much.
Yes, thank you, Dr. Dikra. We are in the Ministry of Public Health as we consider ourselves representing all Yemeni civilians in all area, either north, south, east, west. We make our plan to deliver this vaccine to all of our civilians. And our planning and budget was depending on that. But unfortunately, the Houthi only authority there in Sana'a, they are only after pressure accepting to take 10,000 to the governorate under their control. And until now, they are not taking them. Until now. And whatever we also announce for our health professional college, we can accept them in our governorate under legitimate government. We can accepting them to take vaccine, only they need to register and coordinate with us. But we are ready to deliver vaccine to all area of Yemen.
Thank you very much. Thanks a lot.
Can I compliment what His Excellency, because I do have an update on that. They asked for the 10,000 to be delivered to their warehouses. WHO refused because we had an agreement with Dr. Qasim that it has to be a campaign managed by WHO. So the vaccines are still in the south. We also, they came back and said, okay, we will have the vaccination at the Ministry of Health for 500 healthcare workers, 2 doses each. So they tally to 1,000. What is the rationale behind that decision? What's happening is, of course, something unknown to us as WHO, but we insist that we run the campaign, proper registration, proper monitoring and evaluation in the north, as exactly has been done in the south. So that's the situation update.
Fantastic. Thank you very much, Dr. Adham. There is a question actually to you and also to the Minister of Health. How would Ministry of Health and WHO Yemen office are able to prioritize the most important primary healthcare programs and interventions during COVID-19, given the war and given the 23 of the population, 23 million actually of the Yemeni population needs quality and equitable health services? How can you prioritize your support?
Sorry, I didn't hear the question.
سؤال دكتور قاسم، يعني في خلال الجائحة والحرب وعدم الاستقرار، كيف تستطيع وزارة الصحة إنها تعطي أولويات لتدخلات الصحة البرايمري هيلث كير، الأولويات الرعاية الصحية الأولية، كيف تقدروا توازنوا في الأمر؟ يعني كيف البرامج بتشتغل، بتقدم أي برنامج على أي برنامج، إيش اللي بيحكم في هذه في استراتيجية الأولويات؟ سمعتني دكتور قاسم؟
نعم، yes, Doctor. Yes, unfortunately, we are facing a lot of aspects, but our priority to continue the primary care as a vaccine and the prevention of infection, and we are in good cooperation with our partners at WHO and UNICEF in this aspect, while at the same time we're trying to maintain the other service for the hospital, for the secondary care and for tertiary care. And yes, we are suffering in this area, and Dr. Adham, our colleague, you know that. And now with the fuel, like for example, the fuel for the hospital, next month we are shut down about 72 hospital from fuel that was supported by the foundation from partner. So we are trying to make parallel. We are working on primary and also focus on secondary care. But yes, the pressure is a lot of, and unfortunately this COVID came to make it more worse, yes. But we are trying to go parallel in all healthcare, say the primary or secondary care or tertiary.
Thank you. Dr. Adham?
Yes, excuse me, because I'm responding to the Q&A. By the way, I responded to over 35 questions up to this moment. So can you repeat the question, please?
The question is how WHO prioritize their interventions of primary healthcare services during this acute stage.
So it's the same question. Okay. Now, as you know, there's a pillar from our response, which is the resumption or the protection of essential health services. Well, we do have, you know, and what we mainly focus on is the primary healthcare and the basic services. That includes EPI, which is immunization, maternal child health services, salient current outbreaks like cholera, like dengue, like diphtheria. You know, people are focusing on COVID and forget that Yemen has plenty of communicable diseases, have a devastating non-communicable disease impact, have a big problem of famine and nutrition, essential health services, coverage in terms of the immunization. All of this we are responding to at the same time. And of course, we will not be able to cure an ailing health system even before the crisis happens. But what we can do is to stop further deterioration. And that's what we managed to do in terms of in the last couple of years. However, our ability in the next few months, as Dr. Qasim has mentioned, is really crippled in terms of the lack of funding, especially not for those type of interventions that we care about and we have managed during the pandemic, but to support health facilities to operate. Fuel, can you imagine? WHO has not provided fuel in any country of the world except in Yemen. And now when we approach donors with the resumption of fuel, they just don't want to give us funds. Healthcare worker incentives. These heroes need to be rewarded for what they are doing in remote places, in conflict areas, in COVID-19 ICUs and centers, and they're not. Again, donors have stopped that for one reason or another, and we're in direct discussion with them now to resume that. Water. Can you imagine there are water truckings that is coming from WHO on daily basis to health facilities? Because without water, how can facilities operate? This is how grave the situation is in Yemen. And I really reach out for the international community. Instead of spending millions and millions of dollars on vaccines of COVID, have a look at Yemen. We had a pledging committee, and we had a pledging conference from the UN trying to raise funds for Yemen. We only got 44% of what we asked for. This is in contrast to last year and the year before, where the funds received for Yemen was much, much higher than what we received this year. So my direct response is that we managed to do a good work in the last couple of years. I'm not sure we'll be able to continue with such lack of funding. Over to you.
Shukran jazilan. Thank you very much, Dr. Adham. May I ask you, please, because you said you are responding to the audience or attendees some of the questions. Can you please write your previous response about the 10,000 vaccines in Arabic? I need to just go ahead because I have a lot of dozens of questions.
I'm very slow in Arabic. I respond in English very fast, so it will take.
Can you say it in? Can you resay it in Arabic?
I can spell it out in Arabic.
Please.
لما قابلنا الإخوة في صنعاء اتفقنا على إنه لازم على الأقل الهيلث كير وركرز يبقوا vaccinated أو يطعموا الناس اللي على الفرونت لاين. فالأول طلبنا قوبل بالتجاوب، ثم قالوا إنه لابد من موافقة السلطات الأعلى، واللي أنا ما أعرفهاش الحقيقة، ما بتدخلش في المواضيع دي. السلطات الأعلى سمحت لنا الأول ب 10,000 بدل من 50,000، وهو العدد تقريبا بتاع الهيلث كير وركرز في المحافظات الشماليه. ثم فوجئنا من يومين انه جالنا اتصال انه لا، فقط محتاجين 1000 من ال 10,000، لانه الاول كانوا عايزين ال 10,000 ناخدهم من عدن نوديهم صنعاء فقط ونحطهم في مخازن الوزاره. احنا رفضنا كدبليو، لانه احنا لابد ان كل الكامبين، لانه دي طبعا اذا كوفاكس، واحنا متفقين مع دكتور قاسم انه الكامبين كله تحت اشراف منظمه الصحه العالميه بما فيها التسجيل ومتابعه الحالات وغيرها. فعندما يعني وصلنا المسج دي ان احنا لا نستطيع ان احنا نوفر ال 10,000 اذا لم نكن شركاء في الحمله، فرجعوا لينا وقالوا طب هناخد 1000 ل 500 طبيب، كل طبيب جرعتين، وهتتعمل في وزاره الصحه. ونحن الان يعني الاستاف بتاعنا مع وزاره الصحه في صنعاء بيحضروا للكامبين لل 500 طبيب. ما هو السبب في النزول من 50,000 ل 10,000 ل 1000؟ لا نعلم كصحه عالميه.
شكرا جزيلا دكتور أدهم. Professor Nail, there is a question from you, please. You have explained in your presentation about how the UK or the public health, the Faculty of Public Health can help Yemen. May I ask you, what is the most or the direct option and the very urgent option of that help that UK can support, I mean, immediately without delay? And another part of the question is, what are you expecting from Yemenis? I mean, in your perspective, I mean, what is your expectation or requirement from Yemenis or medical doctors in the diaspora and within Yemen, how to help the public health faculty to raise this concern or these needs? Thank you.
Well, I think that the most immediate need, given that the cuts in the UK aid budget have recently been announced, would be for people to question those, to try to understand the impact on the aid flows to Yemen as a result, particularly highlighting everything that's been presented today about the serious nature of the current crisis in Yemen. So that's an active involvement, people writing to their MPs. The Yemen Special Interest Group that the Faculty of Public Health has established is looking to establish links with professionals within Yemen. And so those medical professionals who want to engage, then I think Anne Hoskins, who's part of the Special Interest Group, may well be able to come back later and make those connections, or others on the call. But I think coordination of what we do will always add impact.
Thank you very much. So you think there is a hope and there will be a response by the UK government?
With the UK, obviously, in the announcements, did specifically highlight that humanitarian aid is going to continue to go to Yemen. So money is still flowing to Yemen, but I think it's important to question whether that is actually a reduction on what we would have been giving had we not had the cuts. So somebody needs to look at the figures and actually question whether the amount of financing the UK is giving has reduced. And given the serious nature of the current pandemic, whether that is appropriate. So that's the whole point of questioning government in a democratic process. Yes, a decision has been made, but if the public disagree with that decision, then pressure to ministers to change it is the way to voice and raise our concern. Thank
you very much. Dr. Maha, given the special situation of Yemen, and the conflict like countries, what WHO regional office and headquarter would they consider Yemen and similar countries a very special case, and would they consider it in their planning and support provided? Dr. Maha?
Thank you for the question. And definitely Yemen, in the region, Yemen and some other countries, they come as a top priority for all fundraising activities and for all the special concern countries of concern, I mean, in the COVID and the non-COVID as well, because they call it like 3 emergency humanitarian issue. We call it for Yemen more than 3 emergency humanitarian issues. So and on the headquarters as well, even in the COVAX facility, in the ACT Accelerator, Yemen and other countries, they have this special situation with similar humanitarian and emergency. They have special situation even in the COVAX facility with the allocated number for countries in fragile contexts, and as well for the pledging for the funds. So it's not only for the funds, but as well for guidelines and preparedness needs, strategic needs in fragile contexts as well. So when it comes to the operationalization, this is the challenge. So we get the guidelines, and it's how to operationalize it as well, given the multiple challenges that exist. I mean, so yes, it is at the top front of all of the concerns in the humanitarian and the fragile context.
Thank you very much. There is a question also.
And as well, may I add something as well, Dr. Zikra? It's not only with the WHO, but I mean, it comes as well even with the League of the Arab States. I mean, for all the governing bodies, or all the umbrella governing bodies, Yemen and countries in similar situations, fragile contexts, they come as a top priority for all of the planning and the strategic planning for the COVID and for all other issues as well, on the economic and on the social part and the health and emergency part.
Thank you very much, Dr. Maha. Again, a question that can be also given to Dr. Adham and His Excellency, Dr. Qasim. Yemen is always, I mean, Yemenis or professionals in Yemen always complain of lack of data. So, and lack of strong surveillance, although Yemen is pioneered actually in the program of immunization and surveillance of some infectious diseases like cholera, etc., etc. So how do you deal with that? I mean, during the pandemic, it shows that there is really an actual problem of lack of data. How do you deal with that? How can you improve that? Thank you. Dr. Qasim?
Yes, Dr. Adukra, shukran. Yes, this is an important area. We have weakness and there is gap really in this area. And I'm interested when Professor Neil Square, he said they are willing to support us in this area for the technical support in the data and in the surveillance and for making our health system more supported with data. Yes, we are suffering in this area. We have, unless we have limited, but we have some system there, if in the Ministry of Public Health in Aden. Now all the, yes, sorry for interruption. So this we have now, we have with the support of the WHO, we have reduced. Yes, we have some system in use and in some program like reporting of some disease. We have now also on COVID, even the number is little and not representing the real number, but at least we have some collection of data. But yes, we have weakness in this area, and we are planning to do support, and we are planning to do electronic health system with the support of our partners, either WHO, they can help us in providing system and data. So we have Dr. Abdullah, who is one of our.
Shukran jazilan. Thank you very much. Dr. Adham, would you like to comment on that, or I can give you another question? Yes, please.
Yes, of course. Now, going back to the health information system, there was a lack of good surveillance system, including health information system, of course. And when I arrived to the country, actually, there was a debate on a system that we are implementing called EDUs, and I am saying this, unfortunately, and in all transparency, that the North and the South did not want to have one health information system and surveillance data for the whole country. Everyone wants to protect his data and not share it with the other. To the extent that we tried so much, and the only way that we have to move forward with that was to divide two servers, each dedicate 2 servers, each for the surveillance data on a platform called EDUs, for both to move forward. And at last, things have moved forward. And now we have trained people on a new surveillance system in the North and South. And hopefully we will aggregate the data at our end as WHO and report as for Yemen as a whole country. But this is the kind of details and problems, very fine details that we face on daily basis, that maybe the media, the public, the people living outside Yemen are not, they think it's easy to collect surveillance data. Even that is under debate and political discussions and things like that. But right now, I'm happy to say that the surveillance system is improving. We are now just only, a couple of weeks ago, we started collecting good data. We started aggregated the data. Probably in the next few weeks, the surveillance data will improve. But it had, cooperation from both authorities in disclosing the data and in and sharing them through this system should be, of course, given to should be, of course, observed. And that's what we're hoping for.
Thank you very much, Dr. Adham. And I apologize on behalf of attendees, but you can realize the situation they are passing through. So I excuse on behalf of anyone. There is a question actually, which is, I think it's of interest to many, and it's directed to you and maybe to Dr. Maha. What other scenarios does WHO have in case Houthis continue not to cooperate with them and not allowing the flow of vaccines to northern parts of the country?
Well, by the way, the authorities in Sana'a are cooperating in all kinds of other, we forget that there are other public health issues, and they are cooperating on all these. But when it comes to COVID, we're really, really having strange responses. We cannot explain. We tried to outreach for an explanation, but you don't, you don't throw away 70% of the Yemeni population, because you're in disagreement on intervention or approach, at the end of the day, they are the ones responsible in front of those 70% of the Yemeni population under their control. We're trying to talk to them, putting evidence. There are signs that they are listening. For example, I'll tell you something. We had COVID supplies in our warehouses in Sana'a that the government refused to accept. They deny that there has been COVID from last August until this wave. When I spoke to Dr. Taha, very calmly saying that the wave is here, that we cannot keep denying that there is a second wave, and that we do have PPEs and PCR machines in our warehouses that can support you in the second wave, he listened and he took them on board. That's a positive step forward. So we have to negotiate politically through science, through convincing the authorities. With all due respect to the audience around this call, you know, it's very easy to criticize from outside the country. It's very easy to have conclusions that are not factual because you're not living on daily basis with us. But I would say if you cannot win all, you don't drop all. If you cannot win all kind of discussions, all kind of things with ministries, and the talk is about North and South, by the way. I mean, Dr. Qasim is also not happy with many of the things that we are doing. He wants more and more, and I side with him. But there is a limit to what WHO can do. We are not the government. We don't have the resources of the government. We don't have the people on the ground as the government. And we're trying, despite all of this, to support with our limited resources and limited number of staffing that we are having. So our approach is a step-by-step technical. We are only technical, we're not political. So we convince with science. And I think we're seeing good signs. For example, when Dr. Qasim took over, he listened to us. He listened to the seroprevalence study showing the high numbers, and he issued great statements urging the population for preventive measures, urging hospitals to take infection prevention control measures. This is excellent. We hope that the North does the same, which is not happening, but I am sure with our technical advice, our talk, with seeing us as politically non-affiliated and we only talk about health, this will happen, but one step at a time.
Thank you very much. Thanks all. I think I need to close the session, although there are a lot of questions, but those questions can be answered in the second session. But can I ask from our distinguished guests to end up with 1 or 2 minutes statement at the end of the first session, and then we will move to the second session. Thank you. Dr. Qasim, shall we start with you, please?
Okay, thank you, Dr. Dikra. First of all, I want to breathe in. There is only one Yemen and one logistic governorate in Aden, and but we can accept the description Sana'a, Aden. There is south, there is north, there is east, there is west, but there is only one Yemen. Okay, thank you.
Excellent. Thank you very much. Dr. Adham?
I agree with His Excellency. The internationally recognized government is the one that we are dealing with, and that is the case. But again, 70% of the population we have to deal with in the north, and we have to support for the sake of the health of the Yemenis, for the sake of the people and population. WHO is not politically affiliated. WHO is a technical advisory entity that works with the government. We are doing our best, given the resources and things on the ground, and we will keep supporting the Yemeni health, east, south, north, west, everywhere, trying to do our best to support the health of each and every Yemeni, and we hope we can succeed. We need your prayers and support.
Thank you very much, Dr. Adham. Professor Maha?
Well, thank you very much, and I totally agree with what His Excellency and Dr. Adham mentioned. This is more than a health crisis, of course, and we all know this. So, and we need to increase the momentum by all means in order to be able to get to this unique moment where the time to be leveraged to give all the communities the tools and to tackle the continuing challenges of the COVID-19 and of other issues, public health issues that are present in Yemen at now and in the future as well. And this can never be done except trying to build robust systems, innovative systems that are able to sustain the response and include all of the stakeholders, and given the support and given by neighboring countries, Arab countries, international communities, and international organizations. Thank you.
Shukran, Dr. Mahar. Thank you. Professor Naim, please.
Thank you. Just to say the COVID virus is our common enemy, and we all need to work together fighting our common enemy. We have to do that together, and solidarity internationally for those more remote from Yemen is what is needed to support that single fight.
Thanks a lot. Excellent. By this, I have to end this session. And again, I would like to thank our distinguished speakers. This is really a golden chance that we have as health professionals and non-health professionals as well, to have their excellencies actually accept to be available with us to clarify the situation, to clarify the rumors behind each agency, Ministry of Health, whatever. So thanks a million for your presence, and I hope to continue with us for the second session.
Great, thank you, Dr. Dhikra, and thank you for everyone for staying this far with us. My name is Arzaq Ahmed, the COVID-19 co-lead for HPY-UK. Our next session leads us to 3 speakers. So we will start with Alexander Young from Edinburgh Genetics Limited, UK. He will discuss the possible ways and recent scientific techniques of tackling the spread of COVID-19 in Yemen. If I hand over to you, Alexander.
So thank you, Arzaq, and thank you to Dr. Mahdi as well for the invitation and the opportunity to speak today. Given the time constraints, I've only got 10 minutes, so everything here is going to be very high level, so I apologize in advance for that. If there are any questions, obviously we have the Q&A, and our contact details for our company are on these slides, so please don't hesitate to get in touch if there are further questions off the back of this. So the first thing I'd like to address is a really basic question. Why should we be testing for COVID-19? And it may seem like a really obvious question, and probably each territory has a slightly different rationale for doing so. But certainly from the very start of the crisis, the WHO has recommended that testing is a core component of the fight against the virus. And I think there are probably three major rationale for that. The first one is probably obvious, is keeping track and understanding the exposure to the virus. And His Excellency Dr. Qasim highlighted in his opening remarks that the number of cases currently being reported is nowhere near the true number. And it's very difficult to obviously coordinate any efforts to combat the disease without knowing the extent of the issue, where the virus exists and where it's spreading most rapidly. And then off the back of that, obviously, of the point of view where when you're identifying these cases, it enables people to isolate. It enables, therefore, people who know those people, health professionals, other members of the public, to go about their business in a kind of confident and unusual manner. And then thirdly, and I think really, really importantly, as more and more countries are rolling out the vaccine to more and more of their population, testing for the virus allows a country to understand the impact of the virus, and if it's working as it should be working, as we expect it to work. And perhaps more importantly for Yemen, the testing is almost an interim solution before you have that whole virus rollout in place. You know, Dr. Adham spoke in the QA as well about diagnostics being really, really key before we have this vaccine rollout. And whether that be for logistical reasons or whether there's a low vaccine take-up, testing for the virus and allowing healthcare workers in particular to have regular testing is really, really, really important before you have this vaccine rollout. I'd like to also quickly discuss the different types of COVID-19 tests. Now, there are really, really many types of tests available on the market. But I've highlighted three of the most commonly used ones here. If we focus first on the top two, so the PCR and the rapid antigen, these two types of tests are both designed to detect patients who currently have the virus. So PCR obviously is probably known as the gold standard of testing and has been since for the last year or so. is really seeking to detect the underlying genetic material in the virus. And if it's done correctly, it's really very, very, very accurate. The disadvantages of PCR is really the complexity of the process. It requires a laboratory, obviously, a number of quite complex machines. Dr. Adham, of course, highlighted in his remarks that there were issues with missing components across the country. So that really is one of the major drawbacks of PCR, is the complexity. And off the back of that, the cost of administering and buying the equipment. Another disadvantage might be the length of time it takes to process that. And if we contrast that then with the rapid antigen, which I'm sure many of you on the call have probably seen, it comes in quite small pouches, little plastic cassettes. And in many cases, it's kind of so easy to use that the user can administer the test themselves. It's easier to store and it's easier to transport when you compare that to PCR. The results are available in 15 minutes. So it's really a lot more practical than PCR. One potential disadvantage, I would say, of the rapid antigen is the fact that it doesn't sometimes pick up the really weaker cases, or those cases which are potentially older cases and maybe not infectious anymore. So from that point of view, the fact that it doesn't detect those weaker cases can be construed as an advantage as well as a disadvantage, because in certain situations, you might not want to isolate or highlight such a case which is already not infectious anyway. Talk very briefly just about the types of testing which are generally being used worldwide. So PCR, like I said, was the gold standard and the original method for testing. As the technology for the lateral flow antigen tests, as well as, I guess, the industrial capacity for these things, more and more countries, especially in Europe, South Asia, Latin America, are moving to they're spending millions, and not just spending millions, but investing millions, and also really relying, I guess, on antigen to do the day-to-day testing of healthcare workers, other workers, members of the public, and using PCR as almost like a backup, or where a confirmatory test is required. And we expect this trend to probably continue. So about how we go about testing and the strategies which different countries are using. Now, I understand, I'm not an expert on Yemen, but I understand that PCR is used almost exclusively just now. I would suggest that rapid antigen offers a solution for some of the problems which I'd highlighted earlier, and certainly the countries which I've listed here. I've gone down that route as well. There's probably as many different strategies for rapid antigen testing, or testing in general, as there are countries in the world. At one end of the spectrum, you would have a strategy where you're testing as many people as you can, as often as you can. And I think at one point Boris Johnson's moonshot testing program was aiming exactly for this. Now that, as it turned out, that it didn't actually turn out like that. But for example, if you look at the screens, Slovakia a couple of months ago implemented a system where they were testing every member of their population, or at least a large proportion of their population, every week, at special stations in various cities and towns around the country. Now that's obviously a severe case, but I think they saw reduction in cases of perhaps around 58%, I think it is, after 2 rounds of this kind of testing. And obviously you can't say that that's directly attributable. There are other factors at play here, like lockdowns and other interventions, but it's still quite an impressive statistic nonetheless. In the UK, I would say our focus just now is broadly on healthcare workers, and ensuring that every worker in the NHS has access to regular antigen testing, and I believe twice a week for active NHS members is the current rollout. The government have provided those tests, and I think send out to each worker's home. and they're expected to administer the tests and report the results if required by themselves. For non-healthcare situations, so other employers, the government again does provide antigen tests. It's not a legal requirement for those employers to test their staff, but it is very much encouraged. In other countries, so for example in Czech Republic and Germany, the situation is quite similar to the UK. The major difference is how it's funded. So in European countries, it's predominantly done through the private sector, and then often reimbursed by the government if the test that they bought is on an approved list. Probably running out of time a little bit, I'm not sure. So I'll skip straight to the consistent features and what might be good for Yemen. I would thoroughly recommend a focus on protection and testing of healthcare professionals. We see this in pretty much every country around the world. You know, there's so many differences in the strategies implemented, but that's quite a consistent feature. Clearly, these individuals are key to the fight against the virus, and even more so in Yemen, where there's not a huge number of healthcare professionals. They're working in areas of potentially high prevalence of the virus. So it's really very beneficial to test these people on a regular basis. And then the other area which we obviously see a lot of testing still is at border areas. And this is one area where a lot of countries still rely on PCR in advance, and they rely on travelers to take that test in advance of traveling. But more and more we also see countries require rapid antigen testing actually at the border. It takes place there. The final slide, just a quick introduction to Edinburgh Genetics. We offer all the kinds of testing which we've talked about in the presentation today, and others obviously as well. The product is fast. It's kind of has results in 15 minutes usually, and is used across European countries just now, as well as other countries worldwide. I remember we provided rapid antibody tests, I believe, to Yemen. I think it was in May or June last year, and obviously we would be more than willing to provide antigen tests if the Ministry of Health or the WHO are willing and interested to explore such an option. I know it says on the screen there that samples are available free of charge to the WHO and Ministry of Health. Really, anyone who's interested in sampling these products and understanding them more, we're more than happy to help out with free samples on that. And then finally, probably maybe not so much related to COVID, but in the future and potentially at the same time as well, the kind of the technology behind rapid antigen is also very effective for other diseases as well. So you have the same kind of product available for other viruses such as cholera, malaria, influenza, etc. And obviously, if there's expertise in the UK, which our company Edinburgh Genetics is not privy to, then we're also more than happy to act as a linkage between the ministry or whoever needs it in Yemen to other companies in the UK to share that expertise as well.
We will now move on to Professor Abdullah Salim bin Ghouth, who is an epidemiologist and professor of community medicine based in Hadramaut University. He will highlight the challenges of COVID-19 in Yemen. If you go ahead, Professor Abdullah.
This is my presentation about challenges of COVID-19 in Yemen. I am Abdullah Salim bin Ghouth, professor of community medicine, Hadramaut University. This COVID-19 is different from the previous SARS-1 and Middle East respiratory syndrome in terms of high incidence and low case fatality rate compared with these two previous epidemic. But the main challenges in the global challenges, I think, in the form of the new variant, either variant of interest or variant of concern. Variant of concern is the most important for public health. And the vaccine, in terms of safety, efficacy, availability, and acceptance. What means these global challenges for Yemen? And what the reflection of these challenges in Yemen? Next slide. This is the epidemiological profile. Dr. Excellency Dr. Qasim and WR Dr. Adhams talk about, a lot about the COVID-19 in Yemen, but I will talk from pure epidemiological perspective. What is the epidemiology of COVID-19 in Yemen? Till now, this is 596 cases until 21 April, but by today, more than 6,000 cases. The case fatality rate 19.2%. In the first wave, the case fatality rate is 29% with 2,099 cases. And the second wave, the 14% case fatality rate. And the second wave, there's increase of the cases compared with the first case by about more than 80%. What we conclude from this figure? We conclude that according to the official report from Ministry of Health, COVID-19 represent as of low, very low incidence and very high case fatality rate in Yemen. When we compare this with the global or epidemiology or epidemiology of COVID in any country, we see there is a difference. And the global epidemiology, there is high incidence and low fatality rate. But in Yemen, there's very low incidence and high case fatality rate. That means the epidemiological situation of COVID-19 may be characterized by uncertainty. Why this uncertainty? How to understand the epidemiology within this uncertainty? There's a lot of challenges. Look for the challenges next slide. Next. There's 5 challenges to understand the epidemiology of COVID-19. First one, the situation of the conflict and emergency in Yemen. What is the impact of COVID-19 on the people in Yemen? All the life aspects in Yemen are deteriorated before the occurrence of the COVID-19. And even the COVID-19 over, the situation will continue to deteriorate it because other reason, as Dr. Adham said. But we focus here in the impact of the COVID-19 on the health system. The impact of the health system, this COVID-19 overstretched the capacity of the health system in response to treatment, diagnosis, and lead to excess death. A lot of death occur when the COVID-19 at the peak in the first wave. And the first wave in May 2020, we noticed a lot of death in Aden. And we do analysis for this death about the death in Aden in May 2020, 3 times or 4 times more than other months and than other years. And this excess death associated with the peak of COVID. Now, in April 2021, still there is duplication of, there is the number of deaths in April 2021 in Aden double than the other months. And in this month is the peak of the COVID. But really, the reason of excess death is not well studied either in Aden or other government. Other challenges is the surveillance, the under-reporting or non-reporting. We know what is reported to Ministry of Health, maybe not the true situation of COVID-19, because some governments don't report regularly, and some government in the north did not report at all. This is affect the understanding the epidemiology. Also, there's weakness of the surveillance system and limitation in case detection capacity. And I will present some slides about this limitation. But also, this is the situation in Yemen. But also, there's new challenges, global challenges, the new variant. What is the variant circulating in Yemen? We don't know. Now, for COVID-19 vaccine available in Yemen, and the campaign started in the previous Tuesday, but still there is challenges. about the delivery of this vaccine, challenge about the coverage. When we reach to the universal coverage, but the most problem, the acceptance of the people and the acceptance of the health worker to this vaccine. This is the global distribution of the new variant B117. This is what's called British variant. Distributed to all most of the countries, especially countries near Yemen, Saudi, Oman, but we don't know what is the variant circulating in Yemen. Why second wave occur? More probably second wave occur due to new variant. What is the new variant circulating in Yemen? There's no capacity to investigate this, and we have no data about it. This is one of the uncertainty. This is the incidence, the cumulative incidence of COVID-19 by the region. The Emro region, 1,155 per 100,000. Now the next slide we see in Yemen, how much the incidence in Yemen compared with other countries. This is the cumulative incidence of COVID-19 per 100,000. In Yemen, 19.4%, very, very low incidence. Look for Somalia, Syria, where so these countries facing conflict, but the health system in these countries able to detect a lot of cases and able to see this incidence. In other countries, Saudi Arabia, this is a high incidence. Why Yemen is 19.4%? This is very low incidence, and this is not comparable with other countries. Next slide. This is the case detection by governorate. This percentage of confirmed cases compared with the suspected cases. The suspected cases, that cases reported and expected to be met with the case definition. But really only in Hadramaut, 59% of the suspected are detected through COVID-19, 50% in Mahra and 48% in Hadramaut and Sayoun. But most of governorate, the detection of the confirmed from suspected is very low. Why very low? Where is the problem? The problem is the problem, and the people not need to test, take lab test, or there's something in the diagnosis. There's some new variant affected the diagnosis, or there is other problem. This is one form of uncertainty. Next. This is the epidemic curve till 16 April. The first wave finished at week number 39, 2020. And the second wave start in week number 5 in the 2021. Now the last 2 weeks, this is curve show that the last 2 weeks maybe there's decline of the cases. It is true there is decline in the case now, or the curve will be rise in the next 2 weeks. We wait to see in the next 3 weeks. This is measure the trend. They not measure the burden of the magnitude of the COVID or the incident. This is measure the trend, and because this reported from one source, the Ministry of Health, I think this the trend is true. Next. But when you compare the curve, the epidemic curve, with the curve of the death, there's in the last 2 weeks there's decline of the cases, while the death still at the peak. So high fatality rate and low incidence. This is one of the uncertainty. Next. The case fatality rate in the last 5 weeks increasing. 13%, 17%, 21%. The last week, before the last week, 21% case fatality rate. Why high case fatality rate? Dr. Gassim said a lot of cases come in critical situation. There's one explanation, but it is possible other causes, the treatment capacity and the capacity of health worker maybe need to be upgraded. Could be was the even this in the case second wave, the case fatality rate is decreasing than the first wave, but still it is high. Next. So here where's the table? So it's empty. So I will explain this. We conduct a zero prevalence survey in Aden in November, December 2020, and the result of this survey show that 27.4% of the people are already infected. One, as Dr. Adham said, when we generalize this 27% to the people in Aden, about 1,000 population in Aden, that means about 250,000 people already infected in the first wave, while Aden reported in the first wave less than 500 cases. There's a big gap between what is reported by the surveillance and what is really reported by the survey. And COVID-19 is acute disease and occurs as an outbreak. That means could be the prevalence equal the surveillance. In this regard, could be the prevalence 27% is the true explanation of the incidence rather than the surveillance data. Other challenges for the COVID-19 in Yemen is the vaccine. Now vaccine, AstraZeneca, introduced in Yemen. Next slide. And this in Yemen. We do study, Mr. Khalid Keddi, Director of Health Education in Hadramaut, do this study within a convenience sample of 321 person, 60% from health worker and 48% from people, and ask them about their knowledge and attitude to wear the vaccine before the campaign started. Next. This picture of the Mukalla city. 94% of the people have no knowledge about the vaccine, and 78% of health workers have no knowledge about the vaccine. But also 75% of people and 74% of health workers, they said they are not agree to take the vaccine. Every day, doctors and people ask us about the vaccine, about the safety of the vaccine, about is obligatory or not, and most of them not refused, but they are hesitated to take this, the vaccine, and this is big challenges, and hope this is solved within this campaign. What's the reason? Why most people not accept the vaccine? 69% say that the vaccine arrived to Yemen are bad, and 48% say that the vaccine unsafe. A lot of news in the television and in media about the side effect of the AstraZeneca, and this make people and health workers hesitated to take the vaccine. We conclude that COVID-19 overstretched the health system in terms of capacity of ICU or the excess death, uncertainty about the epidemiology of COVID-19 from all the surveillance data and analysis and interpretation of this data show that there's uncertainty about this about the epidemiology and no data about the new variant. There's urgent need to understand this. If this maybe some variant could affect the vaccine, I don't know. And there's a lack of knowledge about COVID vaccine, low acceptance or high vaccine hesitancy even among health workers, and the last slide about the recommendation. Next. Next slide. Recommendation, I formulate three broad recommendations. The first one, strengthen the surveillance system through screening for the new variant, establish surveillance for adverse event. This is very important to establish surveillance for adverse event following immunization for AstraZeneca vaccine. Second recommendation, improve awareness and update through improve awareness of health worker toward vaccine through training and workshop, dissemination, or any update about vaccine safety. It is important. The vaccine safety is important to inform health worker about this. The last recommendation, conduct further epidemiological studies. A lot of topic need to investigate in Yemen. Seroprevalence study must be done in all governorates and repeated to measure the level of immunity. Excess death. A lot of excess deaths need to study. I think in the last year, I participated with one research group from one university in the UK and published in BMG Global Health about the measure of the excess death by geospatial analysis, and I provide them the field data from the civil registry and conclude that there is about 3 or 4 times death in Aden in May 2020 than now. Molecular epidemiology, we need to strengthen the laboratory for investigate more about the variant, about the virus, and vaccine side effect. Need to study the side effect of vaccine, either AstraZeneca or the protein vaccination, and to assess the vaccine hesitancy after, during, and after the vaccine campaign. And thank you.
We shall move to our final speaker, who is Dr. Salim Al-Budaiji. He will give us an overview and recent updates about the COVID-19 situation in Taiz. Over to you, Dr. Salim.
Okay, I am Dr. Samer Al-Budaiji from Taiz City. I work with WHO as a national expert for Taiz and West Coast about COVID-19. I will give you an overview about the Taiz situation. First of all, I want to give my sadness and condolences about the death of my partners. Some of them on the right is Dr. Mohsen. Dr. Mohsen was working with the WHO. I am sad to hear from others that say that a healthcare worker and organization like WHO make a profit from COVID-19. Actually, we make death and we receive death and disease from COVID-19, not profit. Healthcare workers should be vaccinated as soon as possible. Healthcare infection prevention and control and PPEs are priorities. Here we can see the situation in Yemen, the first wave and the second wave, and the dormant phase between them. This dormant phase between them give more ignorance, makes the community more ignorant, make the health authorities more ignorant. And I don't know from these figures that COVID-19 may become a seasonal disease in Yemen, and it can yearly. Also, we are afraid that this dormant phase could not be dormant with the emergence of new variant like Indian variant. This is a picture from the ceremony in Taiz City. They are digging more, burying more coffins and more deaths. This is a situation. This is a table showing the situation in the first wave and second wave, and the cumulative cases in the 2 waves in Yemen and Taiz City. As Dr. Abdullah Balwa said, in the first wave, the case fatality rate was 29, and in the second wave, the case fatality rate decreased to 13, with a cumulative case fatality rate about 19. I think the decrease in the case fatality rate and the second wave is not does not reflect an increase in immunity, but reflect an increase in the increase in the number of surveillance. Okay, this is a curve showing that as government comes only after Hadramaut with the number of most cases in Yemen. Also, we can see from this curve that there is weak surveillance in the northern governorate, as Dr. Adham said. Okay, This is the epidemiological curve with epidemiological weeks of TAS COVID outbreak and the second wave. We have reached the peak. There is about 750 cases during the second wave in TAS city. Also here we can see the COVID-19 related deaths during the second wave. About 100 cases died from COVID-19. Also, we have reached the peak within the previous 2 weeks. This is the situation in TAS in relation to Yemen situation. You see the curves and the curves, the red curves and the blue curves below are the situation in TAS. And this is during the first wave and the second wave, the deaths also. Okay, here is the distribution of suspected and confirmed case and TAS during the first wave. You can see in this curve, this is Moha districts has only 6 suspected cases and almost no one confirmed cases during the first wave. You see Moha district and the red arrow. Okay. After training and after probation, also this is Moha city reported no deaths during the first wave. After training, this is figures from training in the West Coast. After training and after probation of PCR during by WHO provided and the IOM provided the PCR facility to Moha and West Coast, Moha districts become the 5th districts in TAS that report cases. So after some training and after provision of PCR, the case report and case catchment increased in Moha city for about 40 cases before 2 weeks. Now it is about 70 cases. Today, about 70 cases and of COVID-19 was detected in Moha city and Moha districts. From this curve also you can see that is the decrease in case surveillance in rural cases and in districts that are situated under healthy governments and in case and cities and areas which lack PCR facility. This is a map of TAS district and the West Coast. The red dots are the areas with more 100.
Yes, we can move on to the Q&A, Dr. Dhikra.
So we will have one question. We will have one question for each guest, and maybe some comments also from our other guests, previous guests, if Dr. Adham, Minister of Health, and Professor Naila are still with us. Anyway, I will start with Professor Bin Ghaouth and maybe Dr. Samer. Actually, we have selected Hadramaut and Taz because they are the worst governorates that have been affected by COVID-19, and maybe more or less they have the good maybe screening system, and that have been shown very clearly from the screening of infected cases. And we don't know whether that's because of the high infection rate or because of the good screening and the good governors actually. Professor Bin Ghaouth, my question to you, and you as an academist and as a lead in your area, and you have done a couple of situation analysis to the status of through the seroprevalence survey or to the Hadramaut in particular. How do you think, Professor Bin Ghaouth, you and your colleagues in academia can support the Ministry of Health and the WHO actually in providing a more accurate situation analysis and to formulate a syndicate maybe for academia to work in solidarity and be as a cornerstone or as a backbone actually for the MOH? Would you please elaborate on that?
Yes, participate in the committee in the Ministry of Health from the first wave. And so I am the chair of the consultancy advisory committee for COVID in Hadramaut. So we did with my college the academic Dr. Sheikh from the Aden University. We worked together to conduct the zero prevalence survey in Aden in November, December, with support from WHO and Ministry of Health. And now we prepare a proposal, as Dr. Adham said, we prepare a proposal to extend this survey in Taiz and Hadramaut and other area. So I prepare some scientific reports about the COVID-19, about the mortality in Aden. Is one of the reports I prepared last year about the mortality, and this report subject of extended study about the mortality in Aden by what I said with one research group from one university in UK and published in the BMG Global Health. But also I recommend, I suggest for with His Excellency Dr. Qasim, I talked with him 2 days back about the need for establish a center for epidemiological study in Yemen. A lot of epidemiology need to be investigated in Yemen, either COVID or either cholera, diphtheria. A lot of topics need to be investigated in depth with scientific center. I think the Minister of Health can take the lead, and we are academic can participate in this.
Thanks a lot, and thanks a lot. And I liked actually the last slide that you concluded your recommendations and overall situation. But you mentioned something which I need to ask about it. You mentioned that you need it's advisable to go through to screen the new variants. Do you think it's very important in such a catastrophic situation in Yemen to know what's the variant of the virus? I mean, is it the top priority to be for Yemen?
Now the vaccine AstraZeneca is available in Yemen, but we don't know in future what the new variant will occur and how to what extent this variant affect on the vaccine, affect so in the diagnosis. So this the uncertainty of epidemiology of COVID in Yemen. Maybe due to new variant, we don't know. For this reason, I said maybe important.
Thank you very much, Dr.
Dr. Dhikra, can I only interference before leaving this point?
Of course, of course.
Well, first of all, thank you, Dr. Abdullah, and also, inshallah, will prepare for his great project in epidemiological center in Yemen. We are preparing for that, and we are open our door for any scientific or help for in this issue, and we are appreciate his effort. Regarding you say about variant of coronavirus in Yemen, actually with the cooperation with the WHO now, we are collecting sample from many governorates and we are sending outside to study the genotype of this variant, and we will publish this study. Thank you.
Fantastic news. Dr. Ali Sidar, you mentioned about the antigen rapid testing, and you might, your company actually, thankfully, might provide some support to Yemen. Is that right? Can you elaborate please on that?
Yeah, so we have provided some support in the middle of last year. This was when we provided the rapid antibody tests, which were really at that point in time they were useful, but you know when you were trying to identify acute infections, really the antibody test is useful, but it's not the best solution. Let's be honest. Now we are in a position where the antigen technology is such that at the very least it can be some component of a testing strategy. So absolutely, we are very willing to reach out and provide help in any way which the ministry would like us to, basically in that sphere.
Thank you very much. Thanks a lot. Your Excellency, Dr. Qasim, would Yemen consider also, and maybe if Dr. Adham is still with us, would Yemen, supported by WHO, would accept the strategy of introduction of antigen rapid test? to overcome the problem with the unavailability of reagents of PCR and unavailability of functioning labs, etc., etc.
Yes, I think we can start in this project, and we are open for this project. We start by rapid test in some isolation center to do a rapid test, and actually we do it in the screen and triage area. We do it now, but we can, no problem, we can let our technical staff discuss with the company, and we can see what is the opportunity for this project.
Dr. Samer,
Okay.
you mentioned about al-Ma'afir, the highest incidence rate or infection rate is in al-Ma'afir, and the lowest.
No, al-Mudaffar and Salah.
Al-Mudaffar and and Mukha ولا al-Makha, لا?
Al-Mukha has almost no case during the first wave. Now, after the provision of PCR, after training, they have about 70 cases.
Fantastic, fantastic. So, in your, of course, we were not able to listen to the remaining of your slides, but is there any raising awareness sessions among the Taiz governorate? I mean, to accept vaccines, and did you start vaccination as well? Is there a community participation in overcoming this pandemic?
Yes, vaccination has started about 2 days ago. However, the bad role of media and the negative impact of the media about the vaccination, especially about AstraZeneca vaccine, and the lack of knowledge about evidence-based medicine from the healthcare worker make them refuse and preclude the vaccination, as Dr. Abdullah Balghous said in the study of his partner, that 75% of the healthcare workers are refusing to get vaccinated. This is a tragedy, and this is the result of lack of knowledge about evidence-based medicine that make people believe in myths and rumors about COVID-19. People preclude to go to the isolation units because they believe that there is a mercy killing in the isolation units. Also, this is another rumor that we are suffering from, the rumor of mercy killing, the rumor of vaccination safety. Also, we have another issue is the abusive use of antibiotics, and most of the drugs that come to Yemen are not tested in the laboratories. A lot of drugs are not working, are not efficient. We are giving patients antibiotics and they have WBC of 33. We give antibiotics according to cultures and sensitivity, and we still have a high rate of infection and ineffective antibiotics. Another issue is that during the peak of the second wave, we ran out of oxygen. So oxygen is a priority. You cannot do anything with dexamethasone, with anticoagulant, with anything without no oxygen has no benefit. Oxygen is a priority in the treatment of COVID-19. And this problem is evident in India. India, the nuclear country, ran out of oxygen and is facing a problem with the new variant, with the new Indian variant. If it comes to Yemen and there is a surge in the cases in Yemen, we will run out of oxygen. This is an important issue. Another issue is the mechanical ventilators as provided for some isolation units. However, there is no electricity in some isolation unit. You cannot run or operate a mechanical ventilator without provision of electricity for 24 hours a day. Also, as Dr. Adham said, water supply in some isolation units is very important. Medicines, supplies, medications, and nutritional support also are another problem. The incentives for the healthcare worker is also a priority to make them work harder and to make the isolation sustainable, especially some healthcare workers who enrolled into the staff of the isolation unit, they get fired from their private works and the private hospitals. Because the private hospitals say, oh yeah, you work at the isolation unit, so you will infect us.
Thank you very much, Dr. Samer. I think at the end, I need just to give 2 comments. First of all, I would like to apologize from my colleagues at the questions and answers. I was not able actually to grasp all your questions, but I tried as much as I can to summarize, because there were a lot of comments and commonalities in questions, and I hope I covered everything that you raised in the Q&A. Second one, a recommendation from this session that we need as doctors in diaspora initiatives and all those who are working also in Yemen, to help the ministry, to help the WHO, to help all those who want to support Yemen by working in 2 pillars actually, which is the community, the risk management, or the community, to make a revolution of awareness, raise awareness among the community. The second one is to maybe work on the relief by providing support through oxygen or ventilators or whatever and capacity building. I think up to here, I'm done with the Q&A, and I would like again to thank everybody who participated, who provided their precious time during the fasting period, and to have you again and again, especially Dr. Qasim. We were very, very excited and happy that you are with us, and we need you. We need to see you every time and then, and we need to support each other. Thanks a lot, and salam from my side.
I want to finish it, with positive note. The positive note is that it was said that whatever we do, we will do it for Yemen, for the Yemeni people, no matter where they are. I think that is a statement we should stick to with whatever we do. The other thing I want to say, that despite all the catastrophic situation in Yemen, there are positive signs that we can do and we can contribute to support Dr. Qasim and to support WHO and to support Samer in Taiz in whatever little thing we can do. I think we are able to do. The Bin Ghoth also mentioned something, that there is this epidemiology, or Dr. Qasim, epidemiological center in Yemen. This is very exciting, and I really would like to know more. I think the best thing will be to keep in touch with HPY-UK and the Yemen SIG, and with all the people who we were unable to answer their questions, and to find those answers if we can, and get in touch with them. Thank you very much for your patience. Thank you.
Thank you, everyone. Have a great day. This video will be made available in the next coming days on the HPY-UK YouTube page, but also their Facebook page. Would Dr. Mahdi or Dr. Ann would like to say a couple of words?
Yes, thank you very much, all.
Dr. Mahdi, I want just to
distinguished panel for your contribution. His Excellency, Minister of Public Health, Dr. Qasim, Dr. Adham, and Professor Maha, and everyone contributed today in this webinar. We hope to work together with you in the future. And as Ibrahim said, the recording will be available for anyone to watch from the beginning to the end. Thank you very much.
I want just to give one word at the last, to thank all who participate in this meeting, and we are grateful for all our colleagues in the outside the country who are always looking for us inside and helping us in different way. We are all thankful for all partners who is from international partner. We are in the Ministry of Public Health. We are open-minded for any cooperation, for any help, and for everything. And Dr. that we want to insist on it. We are always open to cooperation and to discussion any issues that will help our people. And for that reason, we are doing everything that we can. We know we have limited resources and our people suffering, but what we say we will do our best as we can. That is what we think to do.
Thank you.
Thank you for all of you.
Thank you, Your Excellency.